Thank you, everyone, for joining me today. My name is Tara Hicks. I am the director of the Student Health Center here at Seattle University, and I am a nurse practitioner. And I always really enjoy having this conversation each year just to welcome you. It's so exciting to have our new students join us. And I just really want to be able to share with you what services are available both here at Seattle University and in the surrounding area and ways to be ready when you come here in September. I have been at Seattle University now. I'm going on my 13th year. I have been director here for going on my 6th year. So we'll get started. All right. So the main areas that I wanted to cover is the healthcare facilities that are in the area. Also touch on our immunization requirements here, health insurance, and then what to know and what to bring to campus. For healthcare facilities, so the Seattle University Student Health Center is located in Bellarmine Hall. That's one of the residence halls that a lot of first years live. We are open Monday through Friday. Our hours are a little bit shorter in the summertime. It's a little quieter here during that time. Our website is available, and I will have this PowerPoint available on the Student Health Center website main page. So you'll be able to access all of this information. The clinic is run by nurse practitioners, and in Washington State, nurse practitioners have full autonomy, meaning we can prescribe, we can order tests, we can make diagnoses. The Student Health Center can see all students. So this is a frequent question that I get. We do have a student health insurance plan for our international students, but the Student Health Center isn't limited to only those students. So any student who is enrolled or is enrolled in the next term, so let's say they stayed in Seattle over the summer and they took classes in the spring and they're going to be back in the fall and they're registered, we can still see them during the summer. We don't have walk-in hours, but we do reserve same-day appointments for those more urgent type appointments. We see students for a lot of different reasons. We're a primary care type clinic, but really focused on those college health needs. We do a lot of physicals for different programs, for study abroad, and then just regular yearly exams that students need. Acute care, sports medicine, sprained ankles, fractures, those kinds of things, women's health, STD evaluations. We see a lot of students for mental health. So we do take over prescribing mental health medication frequently. And if there's ever a question as to whether or not we can manage something, I encourage students to give us a call. If we feel like it's outside of our scope of practice, we are in a really great community where we can refer. To be seen at the Student Health Center is only $5 to see one of the nurse practitioners. We don't bill insurance at all. So this is always a great place to start. It's cheaper than most people's co-pays or deductibles that they would have for their insurance health plan. We do also have a psychiatric nurse practitioner, and to see her, there's no charge. And we balance, there's a lot of things that the family nurse practitioners, adult nurse practitioners still manage from a psychiatric standpoint. But when there is a higher need or a consult that's needed to determine what medications are more appropriate for a student, we would then refer them to Christine Highlander, who's our psychiatric nurse practitioner. We do have some additional costs for some tests. Vaccines are the most expensive additional costs that we have, and a few supplies. If you go to this link, it'll have a list of absolutely everything we charge extra for. The range for most things is $5 to $20. So for a strep test, it's $10. A pregnancy test would be $5. But the vaccines are what are pretty pricey, but we do charge cost for those. There are options for students who need vaccines to potentially go to a nearby pharmacy, and we discuss those options with students. We also have a relationship with a company called Timely Care. They are a fully telehealth company, and they offer services ranging from a 24/7 telemedical care, so like urgent care type telehealth visits. They have telecounseling, that is scheduled counseling. Students have access to 12 visits with a counselor each year. There is something called Talk Now, which is essentially an urgent mental health. There's something going on. I'm dealing with a roommate issue. I am stressed out about this exam, where they can call in, or they can text or use their computer to be able to talk to a licensed mental health uh, counselor. This is part of their student wellness fee, so they don't pay anything additional when they access these services. And this is really to complement the services that are already on campus. And so this is for the medical care, for example, when the student health center is closed, or if it's on the weekend or in the evening, or the student health center is filled up for the day for appointments. But still, definitely, if somebody is needing in-person care, they're needing a strep test, they would want to come directly to the health center. One of the benefits, there are many benefits to coming to Seattle U, but from my standpoint, one of the really big benefits is we are right in the middle of a lot of healthcare facilities. We have within walking distance 4 different health or medical centers. We have Swedish First Hill borders one side of our campus. Swedish Cherry Hill borders the other side, and they both have emergency rooms. And then Harborview Medical Center, which is the level 1 trauma center for the region, is within walking distance. And then we also have Virginia Mason, which is a little bit further, but it is still within walking distance. We also have urgent care centers that are nearby. They're not quite as nearby, but for students who are needing to go to an urgent care center, Timely Care isn't going to work for them. It's after hours. They really need to see somebody in person, but don't need to go to the ER. The public safety department can be called, and they will give students a ride to the urgent cares. On campus in the Student Health Center, we don't have a pharmacy here. We send electronic prescriptions to the local pharmacies if a student is needing a prescription. But these are some of the pharmacies that are nearby. Also, a lot of pharmacies within walking distance. For those of you who have Kaiser, we do have a Kaiser here in Seattle. It's a little bit further away. It is walking distance. It's uphill on the way there. It's downhill on the way back to Seattle U. But that is, if your student is going to have a Kaiser, they can register as a visiting member if they're not already a member here in Washington State, and have access to that Kaiser. All right, immunizations. Our immunization requirements just changed. Prior to a few weeks ago, the requirement was both COVID and measles. Currently, it is just proof of immunity to measles. And the way to show proof of immunity to measles is either 2 measles vaccines after the age of 12 months. So here in the United States, that is typically 2 MMR vaccines. Outside of the United States, often that's just the measles vaccine is given alone. But outside of the United States, you need to make sure that the 2 doses were given after the age of 12 months. Often that first dose is given at 8, 9 months. If you don't have documentation, you know that the measles vaccine was given, but there's no documentation to be found. There is a blood test that can be done that can show that there's positive antibodies, so that shows the immunity. If for some reason that came back negative, if you're not sure whether or not the vaccine has been given, 2 doses can be given again. If it ended up being the 3rd and the 4th dose, there's no harm in getting those additional doses. So those are the 2 options that we give students if they're like, I have no documentation, what do I do? We give them the option of either doing a blood test, or if they just want to do the vaccine series, they can do that. And we do have the MMR vaccine available here in the clinic. Although our only requirement is proof of immunity to measles, we still strongly encourage students to be up to date on all the recommended vaccines, including COVID. The COVID vaccine recommendation currently, it's changed as we've had new vaccines, but currently it is really just a single bivalent vaccine. So one of those, either the Moderna or the Pfizer, that have 2 different strains of the COVID vaccine. There should be a new COVID vaccine coming out in the fall. And I am already working on seeing if I can get several vaccine clinics set up both for flu and COVID. That information will be sent out to students once I figure out what we're able to do. The other really important COVID vaccine, not COVID vaccine, that regular vaccine that I recommend people looking into is meningitis. The meningitis quadrivalent is one that's been on the childhood vaccine series for a long time, but meningitis B can be a little bit hit and miss. Historically, the meningitis B has been the one that we've seen as college outbreaks. The risk is still incredibly low to get meningitis B, but that is a vaccine preventable disease. So that should be an option. If it's not something that you as a student or your student has received, I'll just pause for a second. We are very close to hospitals, as I told you. If your student hasn't received that, I would strongly encourage just a conversation with your primary care provider about that as a possibility. All right, health insurance. So for health insurance requirements, domestic students have no insurance requirement, and they don't have to show us proof of insurance. But I would still strongly encourage students to have insurance and have insurance that allows them access in Washington State. We don't have an insurance plan available for domestic students. We just have a plan that's available for international students. And the international students do have a mandatory insurance requirement, which is tied to their visa. If you're wanting to look for options for your student for an insurance plan in Washington State, we have a really good website for a Washington State healthcare exchange, and this is the link for that. And then for international students, here is some additional information, both about the insurance requirement. It is an opt-out plan. You will automatically be enrolled in the student health insurance plan unless you waive out with a comparable plan. So there's more information at these sites as well as a link to the waiver. All right, what to bring to campus. So in Washington State, 18 is the age of majority. And so that's when you are legally considered an adult and start making your own decisions. What that means for in the Student Health Center, if your student is under or you are under the age of 18 when you start at Seattle University and you want to use services at the Student Health Center, we may need a consent signed by a legal guardian saying that it's okay for us to treat you. And if you want to look at what that consent form looks like, that's available on our website. Another important part about that is it's really important for all students to keep their emergency contact information up to date. A question that I often get from parents is, do I need to have legal forms to say if something were to happen to my student that I'm the person that should be contacted, that I'm the person who should be informed? And really making sure that there is some way, if something were to happen, that that information is readily available to emergency providers, to hospital providers, is the most important thing. In Washington State, parents are going to be the first person that healthcare providers are going to want to share information with. I was an RN at Harborview Medical Center for quite a while before I became a nurse practitioner. And the first thing we did was try to find contact to whoever was, whether it was spouse or parent or a child, whoever was considered next of kin. We were desperately trying to find out who that person was and contact them. You can always get legal documents in case your child is unable to consent for themselves, but just know Washington State, that is in the law, that we would contact that person. All right, so really important for students to know how to make appointments. Depending on where the appointments are being made, they can call or they can make them online. At the Student Health Center, they can walk into the Student Health Center. They can give us a call. We're in the process of getting our online scheduling in place, so we should have that available by fall for some appointments. There are going to be some other appointments that just need some more information given to the students that really is not very compatible with an online schedule. The information that you need when you schedule, I can't tell you the number of people that have called and they don't know their schedule. So knowing your schedule when you call so that you can schedule that appointment, having insurance information, and then for the Student Health Center specifically, knowing your SUID, and it's not on your student ID card. So having that number available is our best way to confirm that you're the right person. And then how long it takes to get an appointment. In the community, it really varies. We are facing healthcare provider shortages across many different specialties and types of providers. I've heard some people having to wait months for just a routine preventative appointment. Here at the Student Health Center, for an urgent type of appointment, we are usually getting people in same day, if not the next day. For a preventative appointment, typically that's even within a week, so we can get students in fairly quickly. Another question I often get is, should I establish with a healthcare provider in Seattle? When we talk about specialists, my question always is, are you established with a specialist back home? And if the answer is yes, then I would encourage you to establish with a specialist here. I have a daughter who just finished her first year down in California, and she has type 1 diabetes. So we definitely established with an endocrinologist down in California. Even though she has a provider here that she's continuing to see, we wanted things set up just in case. If she had something happen that she needed immediate care, she needed to go in the hospital, we wanted to have it set where there was somebody who already knew her, who had her medical records, that could take care of her. Whether or not you need a primary care provider, the Student Health Center can take over as primary care provider, but we are not part of any insurance network. So if you have an insurance plan that requires prior authorization for a lot of things, so you cannot get an MRI or a CAT scan, there are certain medications that you have to have a provider who's in network to approve and go through that process to be able to receive, then I would recommend establishing with a primary care provider outside of the student health center. If somebody is seeing a lot of different specialists, having somebody who has access to the same electronic health records, our health records doesn't communicate with anybody's, but having a primary care provider who can see all of the specialist records is really important to really being able to help coordinate that care for the patient. And then really important for students to have an understanding of what kind of insurance plan they have. Do they have an HMO? Do they have a PPO? Should they really hold off on doing routine type appointments till they get back home? And in Seattle, it's only if there's a more urgent type concern that they should seek care, or can they see anybody in Seattle? What does that look like for them? This is a nice handout that I got from CMS that kind of goes through all of that stuff. It's so confusing talking about what's in network, what's out of network, what is a copay, a deductible. But this is good information to kind of talk through if you're a student, to be able to talk through with whoever your insurance is through. So whether it's a parent, legal guardian, or if you're the parent or legal guardian, talking with your student about what this is. Deductibles really throw people off. There's a lot of high deductible plans out there. And I've had students that are like, oh no, I have insurance, no worries. And then when they get the bill from LabCorp for $1,000 for those tests, are really surprised and concerned about that. This is a worksheet that we do have on our website that can give you kind of a process to work through with your parent or your student about what your health insurance looks like and what that access is. All right, and then what to bring or what to have on your phone. Definitely having either the actual insurance card or a picture of the front and the back of the insurance card. I have a lot of students who have the front, but they don't have the back, and the back has the important phone numbers and addresses that LabCorp or Seattle Radiology or whomever we may be referring to may need. Having a little first aid kit and a thermometer. If we're talking to a student and trying to triage them, being able to know what that temperature is can help us figure out how urgently we need them in, if they can wait for us till the next day, or if we need to recommend that they be seen sooner. Definitely still having COVID rapid tests. As much as we all wish we were done with COVID, we are not. So having a few of those available. I still recommend anybody who is having any kind of respiratory symptoms should do a COVID test. Should also have some over-the-counter medications that you would take back home. You know, what are those things that are your go-to medication for a headache, for a sore throat, for a stuffy nose, just so you don't have to run out to the pharmacy and grab something if you're not feeling well, that you just already have it. We already talked about Timely Care. That app can already be downloaded on the phone, and students can access it even before they're physically here. So getting that, it takes about 5 minutes to kind of go through that whole registration process, but having it there ready and being able to use it the second that you need it is really helpful. And then I also recommend saving our public safety phone number. So having that contact ready and available in case you need anything from them is really helpful. All right. So I'm going to go to chat here real quick and see if so no questions so far. So please let me know what questions you have. And definitely, if you have any more personal, like if there's something very specific about yourself or about your student that you want to talk about, please give us a call. We're happy to have that conversation and either let you know what our resources are for you or what the community resources are. Oh, yes. So there is a slide that's a brief, like 5-minute video that talks about insurance that is really great. It's available on the PowerPoint. It's also available on the Student Health Center website under insurance. Our insurance broker, JCB, who helps us with the international student insurance, has provided that to us. So yeah, I really encourage students to take a look at that to get just a quick, brief overview of deductible, copay, those kind of terms. Thank you, everyone. It was so great being able to talk with you. I'll stay on for a little bit if anybody was wanting to stay and ask any questions, but have a wonderful day.